Now think about your car and what happens when it's out of alignment. Well, our bodies, they're not that different.
Imbalance can cause all kinds of problems, including neck pain, and that was the case for Katie Bourret.
Well, Katie's here. She's here with Dr. Drew Drummond from the Spinal Balance Health Center. Good morning, both of you this morning.
Nice to meet you.
Yeah.
Good morning.
Nice to
Welcome
meet you.
back.
Good morning.
Katie, I understand you had some problems. You were experiencing a lot of problems. Really affected your life. What was going on?
So a little over a year ago, it was shortly actually before we moved here to the Omaha area, I started having pain, neck pain and headaches in the back of my head that kind of would radiate up here. And I had went to my primary care doctor and had some tests done, had an MRI of both the head and the neck, and those come back completely fine. And so basically, he just, prescribed some medications and they really didn't help.
Right.
And
well, you're a nurse too, which isn't great because you kind of knew that something wasn't right. It's
Right.
not that you knew, it
Right.
wasn't your imagination.
Right.
And so to just get pain pills and go on your way, you weren't
Yeah.
satisfied with that.
Yeah, and so, and then I talked to, I ended up seeing a neurologist who thought I had occipital neuralgia, and I ended up having a couple of injections done, which was short-term relief. But it wasn't until I actually went and got a massage done, the massage therapist recommended me to come and see Dr. Drummond. And at that point, I was having pain every day. I was really searching for an answer to what the problem was. And when I went and saw him, he said, okay, well, we'll do x-rays and then I'll be able to tell you if I can help you or not. And fortunately, he said, yeah, I can help you. And he was able to show me where I was out of alignment. And but it wasn't just like, you go and get a couple of treatments and then you're good to go.
Yeah.
There's a
It
course.
doesn't work that way. Listen, we've heard this story. We've heard this story before from Dr. Drew
There's a
Drummond's
course.
patients. But this really, it went from bad to worse quickly, your pain, and it really affected your life, didn't it?
Yeah, I mean, I was supposed to start work at a hospital, and I wasn't able to do that because I was still having pain every day, and things like lifting, I couldn't lift up my kids, I couldn't go grocery shopping to lift the groceries. I'm a runner, and I couldn't run, and that was really devastating to me. And so all those, it was really affecting my life in all those areas, and so, but it wasn't just, like I said, it wasn't just a few treatments. It was, just week after week, and he just kind of encouraged me to keep hanging in there because it did get worse before it got better.
It took time, but really you couldn't work, you couldn't play with your kids, you couldn't run, do things you love to do. What was going on, Dr. Drummond?
Well, she had a problem with the way her nervous system was functioning. Basically, it's what we do at the Spinal Balance Health Center, is we get the nervous system functioning better. There's a video that we can show. The way the nervous system works is very simple in an easy description. You have a brain that's sending nerve impulses out to the body, just like this video is showing, and then the body in turn sends nerve impulses back up to the brain, and it's this communication that allows all of our body functions to work properly. And there's a bone right at the base of the skull on the top of your neck called the atlas, and it becomes easily misaligned through accidents and injuries. And when that happens, it disrupts the communication from your brain out to your body and can lead into any number of problems with really basic physiology like posture and balance and blood flow, blood pressure, digestion. And so what we do is we fix that misalignment at the top of the neck, allowing the nervous system to function better.
What stands out to me is she had, when she went to see the specialist's MRI done, why wasn't her misalignment detected then?
Yeah, MRIs it's a wonderful diagnostic. I mean, you can really see a lot of great things about the tissues of the body, but what an MRI is limited to is, it doesn't look at alignment issues. I mean, to find out, the misalignment at the top of the neck is very, very small, so you have to compare the head to the top bone of the neck, to the rest of the neck, from 3 dimensions, from the side, from the front, from the top, and then put together a vector of correction to correct it. And an MRI just can't do that, so it's a wonderful tool, but it's limited. It can't do everything.
Your type of treatment is called NUCCA. And I guess, is the adjustment itself, what's it like? Because I've heard other patients talk, explain the procedure, and it doesn't seem to be painful at all.
No, it's very gentle. We do a lot of comparing from before to after the adjustment with people's posture, with the actual misalignment itself through a pre and post x-ray, through how a person feels, because they really don't feel a lot. Patients are left a little short after it's done because they don't really feel like a lot is happening. And especially in a case like Katie's, I mean, she was fairly complicated to where it wasn't one of these day and night improvements like we've seen with some of the patients I brought in. She had some complications that her body had to work through over time. But luckily for her, she knows a little bit about the body and she could understand what I was saying, and she was willing to be patient with it. But if you were just judging by how much it hurts or what the adjustment feels like, she probably would have quit early because it's gentle.
And you went from not being able to work, you're back working as a nurse now,
Yes.
and running again.
Yes.
We heard you qualified for the Boston Marathon,
Yes.
which is to be commended.
Yeah,
You've
thank
got to
you.
feel, are you recommending this treatment after you've seen what it's done in your own life?
Oh yeah, I definitely would recommend it. I mean, it definitely was a big factor in me being able to go back and do all the things I love
And
to
most
do.
importantly, taking care of your kids
Yeah.
well
Right?
again.
Work again, all that type of stuff. Dr.
wonderful.
Drummond, what should people know to figure out if NUCCA Care is right for them?
Really, you just have to have me take a look at you or somebody that does what I do. We take a look at posture. Posture is a great indicator, and then through x-rays we would know for sure.
And you see a special offer on the screen right now. It is limited to the first 15 people who call today, but you'll get a consultation, you'll get x-rays, all at a terrific value. To make your appointment, call 402-452-3400. Mention the Morning Blend so they know it's this special offer you're inquiring about. You can also learn more about NUCCA Care online at spinalbalancehc.com. Thank you, Dr. Drummond.
Doctor.
Thanks
Good
for
to
having
see
us.
you.
Thank
And
you.
congratulations on everything, Katie.
Yeah,
It's
thank
nice to
you.
meet you.
Yeah.